Our workers are remaining safe. Again, and I think that's the result of their commitment to good practices and our very purposeful policies and staffing adjustments. All of our departments are continuing to work together and with the county and across jurisdictional lines to implement best practices and collaborate. And I feel that's a big part of why we've done well and have not had a problem as of yet. This Friday, we will be having a Board of Works meeting at the regular 10:30 scheduled time. It will be a virtual meeting. So again, just following on Boxcast, our streaming services that we're watching on now, we will have a virtual meeting with myself and the clerk treasurer will be present. The other two members will be calling in. We got to play a little bit of catch up. We've been getting behind on some of the things we need to sign. So we will have a meeting this Friday. Late last week, we did get a little bit of a prediction of how this COVID will impact revenue at county and city level. Dr. Michael Hicks, economist from Ball State University, did some calculations, and we're probably looking at the big impact being next year, anywhere from 15 to 20% reduction in our local option income tax. Carrie, I probably haven't discussed that with you. This just came through. I'll be glad to share that with you. Again, that's just based on modeling. He actually provided two different examples. There isn't, again, any, I mean, it indicates that there's going to be a negative impact on state revenue and local revenue as far as counties and cities, and the early prediction was 15 to 20% reduction in 2021 revenues from the local option income tax. So for what that's worth, we're working with our state association. I know the Association of Indiana Counties and AIM are both working with the governor's office to try and mitigate some of that reduction, to look at ways to provide some stimulus to cities and towns and counties. So more to come on that. But you know, that's our first indication of probably what we thought is going to happen. A little bit of good news. I know the airport just last night was awarded $69,000 of CARES stimulus funding from the FAA for just operations and maintenance during the downtime. So I think all airports in Indiana received some portion, and the city portion was $69,000. We also heard that the project that we've got in 2020, the north-south runway rehabilitation, the FAA is going to forgive the local portion, 5% local match portion of that, which could, again, save us somewhere around $100,000. So two small bits of good news yesterday, both on the airport front. I have been working with Alan Teo at KEDCO, and I know Rob probably has some information on this as well. We're looking at, we're exploring a small business relief loan for our local small businesses from the COVID-related impacts. Details will emerge on that, but I know the city will run this up the flagpole with the council and get their thoughts on it, and I think we all feel probably an importance to at least look at it. As small businesses are certainly, I guess on the positive side there, I know a lot of the SBA loans have started to come through, and that's going to be helpful. Stimulus numbers are coming through, but Rob, I won't steal your thunder on all that. Again, those are things that again, just want you to know the city is working with KEDCO on that loan, small business relief loan. Again, I've said this before at our last meeting, I'm continue to be amazed at the local response to support our non-for-profits, support our businesses, providing meals, sewing masks, et cetera, et cetera. I can't go without thanking our community for the way they've responded. I think one of our problems is we have too many people want to volunteer, and that creates an issue with social distancing. But boy, there's no lack of collaborative spirit and willingness to give for our neighbors in this community. And I don't think anybody should be surprised by that, because that's what we are. But I don't want it to go unnoticed, and I'll mention it every time we get together. Finally, I just wanted to briefly discuss the new topic of the week, and that's looking ahead and potentially seeing a light at the end of the tunnel. And you know, the question of the day is, when are we going to be back to normal? And I know the CDC and the federal administration have, I think they're working. I think there's a little wrestling involved to try and figure out the best approach and the timing on that for the country. I do believe, I listened to the governor yesterday, and the governor, our governor at least, is working with the administration to develop a plan for the state. And I do feel like our governor will, make those decisions in lieu of the public health information as that continues to come out. If any of you are watching the governor at 2:30 every day, it's always started just like we are today with an update from the public health side of this problem. And again, that needs to be front and center. And I think that is what will guide our governor's decision with the guidelines from the federal government. So, our understanding, I tried to read through that CDC document this morning, and it's pretty lengthy, but, they pretty much talk about gradual, phased in, lifting or phasing in some community mitigation measures. Those are quotes from that report, and that can mean a lot of things and mean different things to different communities. So with that, that's probably a good transition to Dr. Remington to talk a little bit about where those numbers are in our community and how they are impacting our community, and maybe a little bit of future look over the next few weeks. And of course, our now routine question, what inning are we in, Doc?
Thanks, Mayor. Great questions. We have 19 confirmed cases for the county. We have reporting of 8 recovered patients and 1 death as of this morning. We keep waiting for a surge beyond what we have, and I thought we'd see it in the last week since our last meeting, but thankfully we haven't. I'm hoping that if we're going to see a surge, the initial modeling for our county that I received from downstate was that we would see the peak of that surge either this week or next, with pretty heavy presence until early May, and then a tapering off coming down the other side of the mountainside into early June. I understand that the State Board of Health's prediction for the peak of the surge was pushed back recently for an additional 2 weeks yet away. So we'll see. It remains unclear in rural counties like ours that have not seen a tremendous number of cases whether we will see an out-of-phase surge to the statewide or national statistics. Nobody knows that issue. In talking with my communicable disease nurse just this morning at some length, I really sense some guarded optimism. We're not feeling a crush of new cases, obviously, as I reported to you. We're not hearing voices of, I've run out of testing supplies, can't get to a test. My health department staff is this very morning distributing 2 pallets, as I understand it, of personal protective equipment that came to us late in the afternoon yesterday from the state, and will be doled out to long-term care facilities. We've been particularly tasked as a local health department to facilitate long-term care facilities and the sense of vulnerability they have. I am most guarded, I think, in that camp, just bracing for a cluster of bad cases coming out of a confined setting such as a nursing home or a jail. I hope we never see that. We have not seen that thus far, thankfully. So all that to say, I think these heavy-handed suppressive measures, the social distancing and the debilitation economically to so many businesses has actually had a wonderful result for our county. I'd like to think that. I think we have not seen a horrific surge, perhaps because we've done well on those fronts. So my message this morning is to keep it up, at least aggressively, for another couple weeks through this month into early May, and we'll stay tuned to the voices from our governor. The State Department of Health will be leaning into that guidance particularly strongly as we think of how this may look as we loosen up some of the social measures we're doing now. But I really do sense perhaps some light at the end of the tunnel today. I thought between last week's conference and today that we would see this horrific clustering of cases swamping emergency room and urgent care centers, but we have not. So keep it up, at least strongly, another couple weeks, 3 weeks, stay tuned. Good work, we're getting somewhere. Things won't be back to normal in June, but things will be much different by early June with our businesses. I'm confident of that. Thank you.
Dr. Remington, you'd mentioned that Dr. Box at the State Department of Health had talked, I believe it was earlier this week about, or maybe last week, about pushing that peak back a few weeks or ahead a few weeks, and that really is a good thing in that whole flattening of curve discussion we had at the beginning of this.
It's true. That's true. When you're successful in that paradigm of flattening the curve, that's exactly what you see. The peak of the mountain is actually a peak of a rolling hill, but it's further down the calendar.
So we hope that continues, obviously. All right. Well, thank you.
Yep.
All right. Commissioner Carrie Groninger is here to just give an update on county conditions, concerns, and any responses.
Sure. Well, just bring you up to speed, I guess, that as far as county government, we're still open for business by appointment only. I mean, if somebody has something that they feel as though is urgent or essential that they do need to get accomplished, we're still, our department heads are receiving phone calls and making those appointments to limit the number of people in the building, in the office, to bare minimum, but trying to not allow those things that have to continue to go on, because there is some things that in the county government that we have to be able to provide services for, obviously, not only law enforcement, but some of the recording of the deeds and such. So just trying to do everything we can for our residents here in the county to make sure we're doing what has to be done, but keeping that to a bare minimum. Yesterday in our commissioner meeting, we did vote to extend our stay-at-home order for the county employees, as long as the governor extends his order. So we'll hear from him, I think, on Friday on what his plans are, because that does run out on Monday of this next week. And when we do that, it'll be a little bit of a soft start for the county. We're planning on, once we would come back, we'd have 1 week that it would still be appointment only, with all the employees back at work, trying to get caught up from some of the things that they weren't able to do over the past few weeks. And then, then starting that second week that would be back would be more of a normal week that you wouldn't have to have an appointment. There's still obviously going to be a lot of social distancing as far as if you've been in the courthouse, but we kind of have tables across the doorways just to keep everybody out as they would come into the hall, so they're not back in an office, in a confined space. Just trying to do everything we can to minimize and keep our employees safe, but still allowing our constituents to be able to get the services that they need. Yesterday in our commissioner meeting, we did vote for a letter of support for the KEDCO loan. Alan phoned in and did a remote call, and we voted for that in support of that. I know that Rob will be talking about that here later. Overall, just a lot what Joe's had to say. Just appreciate our community, how it's came together, how people are looking for ways to serve, how they're doing what they're told from a social distancing to try and flatten that curve. And I think we're seeing some positive signs because of that. So I just appreciate it, what everybody's done. Just cool to see a community come together, which I knew we would, and be able to do what we need to do to get through this together and get on the other side and hopefully get back to more normal life. And listen to a lot of different people. Moms are going crazy with kids in the house and way too long, but it's good to see our people doing what they need to do to stay safe and stay healthy. So appreciate that.
All right, thank you. Now, Rob Parker, Executive Director of the Chamber. Rob, I'm sure there's a lot to discuss with regards to how our local businesses are trying to get through all this and again, hopefully a little light at the end of the tunnel.
Yeah, definitely. First of all, I just want to echo your comments first and foremost, that when you mentioned the amount of people in our community that just have the right heart and spirit to take care of each other. We've seen that countless times, making of the mask and just volunteering whenever there's a need, people stepping up and helping each other. And I'm just so proud to be in this community and represent it. And I'm just so thankful that people have that heart and that spirit just to take care of the fellow man. And that's just awesome. By now, if you're a small business, if you're under 500 employees, I hope you've taken advantage of the PPP or the EIDL loan, the personal protection plan, or the EIDL loan from SBA. If you need any information on that, go to the Chamber of Commerce website, kchamber.com. We have links to all those sites with all the information. We do know that the PPP is oversubscribed at this point. So if you haven't submitted your application, the likelihood you'll get it through is probably low, but I'm hearing that there will be additional funds, probably within a week or so. At least that's the hope. EIDL loan is still available for individuals who need that, and that is the Economic Income Disaster Loan. And if you apply for that loan, you can get up to a $10,000 advance if you can show that you've been economically impacted by the COVID-19 virus, but that is $1,000 per employee up to a $10,000 grant. So those are just some things that I want to make sure people are aware of. If they haven't taken advantage, get with your bank is the first fastest way. If you don't have a bank, if you are banking with an individual or with an institution that cannot apply for a PPP loan, there are 3 ways to do that. It's you can go to Lindio, Fundera, or Cabbage.com. And again, that information is on our chamber website. So for those who are underbanked or banking at an institution that does not process SBA loans, there are other ways of doing it. Just a quick thing from what we've done at the chamber. Some of the things you've seen around town. Just an example of the heart is we put those open signs. We had big picture imagery. Donate those for all the restaurants to let people know that the restaurants are open for curbside or carry out. I'd also encourage individuals to check out To Go Kosciuszko if you're looking for what businesses are still supplying food and what their specials are. We've created that group within Facebook, and within a week or so we were up to like 6,000 or 7,000. We're now over 8,000 individuals that are checking in daily, and it's a great way for us to help support our local businesses. And then there's another group that we created called Support Kosciuszko, again within Facebook. And that's just an area where if you need something, if you're a nonprofit, if you're serving our individuals in this community, you can post something on Support Kosciuszko. Again, I encourage people to go there, post, and help each other to get through this pandemic. So from a economic perspective, where we're at, I mean, it's trying times. Supply chains are being disrupted. So we're going to see challenging times ahead, and I just want to encourage people to, really shop local, to support each other, and we will get through this together.
All right. Well, thanks, Rob. I know you're working hard. Everybody has a different lens on this whole thing, and we're all taking calls from the beginning to the end of the day with questions and concerns. And again, I know connecting proper resources with proper requests is a big part of what we're doing. And again, there's not a shortage of willingness to help in this community, and I think we've all kind of echoed that. So I do want to clarify one thing before I open it up for questions. We talked last week, the CDC, I think, had just made recommendations to wear certain types of masks for the general public when you are out in public. And Dr. Remington, I'd like you just to address the appropriate type of mask that citizens wear to the grocery store versus emergency personnel and potentially hospital workers, because I think there's still a little bit of confusion about that, and talk about the importance of that.
Well, I think it is important when stepping into a grocery store or a market of any kind, if you cannot avoid it, to wear a mask. It's a show of good community spirit that you are there to protect the cashier in front of you when you get to the line. It's to protect you to some degree for the inadvertent close encounter with another individual. In those settings where it'd be very difficult to have social distancing, stepping into any store, any commercial building, please wear a mask. Now, these do not need to be medical grade masks. There still is a distribution issue with some of those, and we would prefer the general public not be utilizing those so that they can be freed up for medical environments, hospitals, emergency rooms, urgent care centers, that kind of thing. So a cloth mask of some variety is okay. Are they as good as the medical masks in preventing small particles from entering your airway? Well, probably no, but it's something. And should you inadvertently cough or sneeze or just in talking expel droplets of COVID unwittingly, a cloth mask in front of your mouth and your nose greatly decreases the spread of those droplets to those around you. And as you have heard, this issue of inadvertent pre-symptomatic or asymptomatic spread is growing large with this topic as we come to understand the virus. So please wear a mask when entering any domain in the public where you would be confronting a cashier, greeting someone at a door, entering a store with aisles, bumping into people. Please wear a mask. Great idea, but it does not need to consume medical grade masks that we use and need in the medical settings.
I know I heard Dr. Box, I think last week, Indiana State Department of Health, talk about a lot of people have those medical grade masks or surgical masks that they've used for home projects when they paint or around fumes, and people were asked to go out and check in their garage and see if they've got some medical grade type masks that could be donated to, the long-term healthcare facilities I know are really struggling getting masks. I do believe also there's a very large contingent of folks that are sewing masks for the reasons you've talked about. And I mentioned last week, and I'll mention again, I know Parkview is taking those masks as well as Kosciuszko County Health Department. And I think if you as a citizen would need a mask, a cloth mask, those are probably two places that you could maybe make that arrangement. I might call before I show up. I'm not sure the best way to distribute those masks, but what I do know is there are a lot of folks making masks, and they're trying to distribute them to, the healthcare channels and the emergency response channels. But I think for the general public, maybe we need to figure out a little bit better way how to get those masks out to the general public. But again, if you do have medical grade masks, I would ask that those be donated to a healthcare worker. If you know a healthcare worker, probably the best way to do it is directly to them. Again, the nursing homes, excuse me, the hospitals, the medical clinics, I think that would be really, really important, and not really need to utilize those for going to the grocery store. So with that, I'll open the questions up. Our two reporters here, Dave Sloan from the Times-Union and Nick Duranick from News Now. Here we are. Mr. Duranick.
Dr. Remington, does it matter right now with Kosciuszko County and the surrounding rural counties with the density population that we have in this area? Has that been a factor into the amount of cases that we've gotten compared to larger areas like St. Joseph County and South Bend, Allen County, such as those? I
would say it certainly does. There have been some surprises in rural counties, too. Southern Indiana has had some surprises. Non-metropolitan areas with surprising case count densities. But I think your point's well taken. The fact that we are not in a large metropolitan area here has been a blessing for us.
Okay.
Have there been any businesses in the county that are non-essential that have been open that have been told to close, or vice versa, or any issues with county businesses that should have been closed but aren't, or vice?
So the question, and again, we're not passing the microphone around, so we'll rephrase the question here. Mr. Sloan just wants to know if there are county businesses that were non-essential, that were opened and were asked to close, or vice versa. I guess the idea was talked about at the last press conference we had, that the state and Department of Homeland Security have defined essential businesses. The enforcement of that has been left up to the state. We do know of one business that was impacted last Friday by a visit from the state law enforcement. That has been resolved, and I know that was resolved in the business's favor. We have not been made aware of other complaints in the county. Carrie, I don't know if you've...
So that's the only one that I've heard of.
Yeah, so it's my understanding. Rob, have you heard of any?
Yeah, just the one.
So it's my understanding that the state law enforcement is responding to complaints. They're not out sweeping. They're not out going door to door. I know the governor last week had made mention that there was over 250 complaints, and they'd issued 89 closure orders. So, you know, with 92 counties and over 200 complaints, I assume that there's been complaints, but our law enforcement is not brought into it unless they're requested to by those state law enforcement agencies. You know, it's a good question. Again, I think what we've seen in our community is we're just relying on people to understand how critical it is to follow these guidelines. There are a lot of businesses that have closed their doors, and, you know, it's just part of trying to do what's right, do everything we're talking about to try and be able to see the light at the end of the tunnel. But that designation between essential and non-essential is been drawn by the governor's executive order. I think if you get online, it's Executive Order 20-08. And then Department of Homeland Security, IGA, sent out a memo that I think the governor is using to support those designations. Was sent out in late March that defines essential businesses.
And I know Polaris and Wildman have both laid off people due to COVID-19. That was going to be the word notice. Have any of you heard of any other companies that are laying off either temporarily or permanently due to COVID, or is
Well, I think, Rob, you can probably handle that.
Yeah, at this time, I haven't heard of anybody. The Polaris situation is a little different than Wildman, and I think that's appropriate here to note. I think Wildman will come back from this pretty quickly once their customers come back. So that's a light at the end of the tunnel. Polaris has made a decision to completely shut down the lines that are being manufactured in Syracuse, and that is a long-term impact. And it's devastating to see, the Rinker Boat name that we've all probably grown to love and see around our community no longer being made here locally, or no longer being made, period. So it's sad to see that, and it's again, every business has the right to make a decision what they think is in their best interest, but it definitely has significant impacts on the families of individuals who are working there. There is good indication that there are jobs available in Elkhart for them, but again, that is quite a commute for many individuals, especially if you're working or living in Warsaw and working in Syracuse, to go all the way up into Elkhart. So
I would have to add, though, that I think there are a lot of furloughs on the small business side. I can use my own business as an example. With business being down, there are stimulus plans. Rob talked of the CARES Act. There's FMLA extension for small businesses that there didn't used to be, that provide tax credits to pay these individuals to stay at home with their families or care for a loved one with COVID, or treat themselves. So there are stimulus available, and I think, of course, with unemployment numbers being through the roof, I'm sure there's a lot of small businesses that are furloughing folks with the intention of bringing them back when, this all comes back together. So, Rob mentioned the larger companies in the community, and we all know Zimmer Biomet laid off for 2 weeks, or shut down for 2 weeks is probably a better term.
Yep.
I don't think they laid anybody off
No.
for that purpose, but I think there are businesses that will be permanently impacted by this, as Rob's suggestion came up, and there's probably more of that. The dust will settle once we kind of get back to normal, if there is such a thing. But I would say that the small businesses have been hit pretty hard, and hopefully they are taking advantage, as Rob mentioned, of the stimulus available to try and keep employees paid and keep them on the payroll, keep them hired. Comments, Carrie?
Yeah, and I think that a lot of these small businesses, the administration has given these businesses a lot of tools in their toolbox to use, whether that is, some of the PPP loans or some of the EIDL loans, or even the unemployment. I mean, they've increased that significantly. I mean, Indiana historically has had a pretty low payment on their unemployment, but I think additional $600 or something.
Yeah.
So, I mean, there's some significant money that I think each business has to look at what's best for them. If they think this is just a 3 or 4 week deal, or 8 weeks, some of the loans may cover that, but if it's going to be longer term, they may have to look at furloughing or laying off those people. And it's probably in the best interest of the employee to do that. I mean, because of some of the safeguards they've put in to allow those people to receive a significant amount of unemployment for a long period of time to help these businesses get through this. Because you're right. I mean, some of these are kind of impacted up front, and some of them are going to be on the backside, because this all is, we talk about a supply chain deal. I mean, are you at the front or the back of that? So that's going to depend on when you're affected, whether it's right now when the crisis is happening, or whether it's going to be 6 months down the road when nobody can get what you need to be able to do your project. So it's going to be interesting to see. So I do think that they've done a lot of things to help employers and the employees, make a wise choice on what's in the best interest of their employees. And I'm confident that a lot of businesses are, we go from a roaring economy just a few weeks ago to this. It's just, it's like you hit like a dog hitting the end of its chain. I mean, it's just drastic, that I don't know any business plan could be prepared for something as drastic as this, that there's no idling down or, it's just an abrupt stop. So I think that, it's going to take some time, but, I think there is a lot of opportunities, or a lot of different things out there that businesses and employees are able to do to try and mitigate some of this impact as much as possible.
Yeah, I'd like to say one quick thing. That extra $600, it is challenging for people who are unemployed right now to get that. It does take time. The system's overwhelmed because there are a lot of people being laid off. But I'd say I would commend the federal government and our legislators on making sure that there's extra dollars on the demand side of the curve from the economic perspective. That's one thing we learned from 2008 is get the money into the hands of people quickly so that it can blunt a recession. So that's the hope, that's the prayer, that extra money then will help create demand, which will bring our companies back quicker.
Right.
All right, thank you. Dan Spalding from Inc. Free has submitted a few questions, and I'll read those. The first question, is there any talk or activity on the local level about how a reopening would be planned? If so, who will be involved? I think we've discussed that to some point. I would say from a city standpoint, I'm very reliant on, number one, the local and the State Department of Health, primarily the State Department of Health and the governor's office relaxing those stay-at-home orders as they see fit at the appropriate time. So I don't see that, and I would defer to you as being a local decision.
I agree. I think we'll lean in heavily to the state direction. I think we need to have good local data, even though data on the local level is sometimes too small to make the best decisions. But yet I think we need to have a good finger on the pulse, and I really feel that as a priority for our health department to be shaking the tree for as much information as we can get so that it folds into our decision making.
Carrie, your thoughts on that question?
Yeah, same thing. I mean, we're going to lean heavily on that governor's order on what they choose to do as far as extending the stay-at-home stay or how we would handle that. So, you know, as we look to the future on what that would do, you know, we're as commissioners, or at least I'll speak for just me, I guess at this point, you know, that I don't know that there's anything that we've really talked about that's even greater than what the governor's asked to do. I know there was some different things that people were thinking about that could possibly be done, but you know, we're pretty much staying lockstep with what our state officials are telling us.
Right.
I would just say that, you know, we are going to open up at some point in time, and we need to rethink from a business perspective how that looks for our consumers. So, you know, from a restaurant perspective, maybe we have to transition from a menu that everybody touches to maybe a disposable menu to each individual. These are things you need to start thinking about at your business. How does your business impact your customers? How do you interact with them? And what ways can we limit that spread? So even though our numbers are down, we need to, and we do see the light at the end of the tunnel. I believe there's a ramp that we can start coming back to business. We need to make sure we're following CDC guidelines and making sure that we're doing everything in our best, in our power to not contribute to the spread of COVID-19.
Yeah, and I mean, I think the federal government is certainly looking at their thoughts on this. I mean, they are the ones that are providing a lot of these stimulus packages. We all know, you know, the elephant in the room is this balance between public health and the economy. And the longer this goes, the tougher that balance is. So, you know, we have to not let our foot off the gas when it comes to the public health reasoning for doing what we're doing. But by the same token, dig down a little deeper, as Dr. Remington suggests, at the state level, and then even at the local level, and then as Rob suggests, then apply some things that we can do to again, mitigate even a potential second wave, because that does seem to be what's in the back of everyone's mind. If we open back up, are we prepared to, are we going to be prepared to handle that second wave? So I still feel like the model that the vast majority of states are following the governor's lead on these stay-at-home orders and these restrictions with guidance from the federal government is how I think we will approach this. And Carrie, again, if I'm not speaking correctly, but I think that's how we would approach that locally,
Right.
is to follow the lead of the state with more data.
You know, and I think what Rob said was a really good point from the standpoint of, even when we come back, it's not gonna be, we flip the switch and it's business as usual, and there's no more social distancing, it's gonna be a gradual ease back in that, you know, some of these things may even be here to stay. I mean, it's just, it's incredible how things have changed in just a few short weeks of, you know, a simple handshake and greeting someone that you grow up doing, and how awkward that seems that you don't do that. It used to be rude, now you're being politically correct if you do that, you know. It's just, it's weird how it's changed even some of our social behaviors so quickly in our community and country.
So, other questions,
When
David?
things start to get back to normal, for people who aren't like hired back, will there be, like job fairs or the, I mean, how, who will, I guess, be a part of that, or, I mean, how important will that be?
Yeah, I can answer some of those. I mean, certainly, you know, each business, how much demand will be coming in? How much do we need to hire back? These are tough questions right now because we don't know the future. It's hard to predict when customers will be buying all of the goods and services we provide. But certainly, there are many players in this community that will do job fairs. We had a career expo that was scheduled for today, actually, at Grace College, and we're postponing it to November. And that's to take care of all the juniors in Kosciuszko County, so they're aware of the jobs and the careers we have here in this community. So that kind of activity is going to continue. It's just like everything else is probably pushed out to August, September, October. It's going to be a busy fall.
I think the infrastructure for job fairs in this community has been, is there. It's been established with our low unemployment and constant problem of seeking a qualified and adequate workforce. It's been so much of a problem, and now to completely flip that to the point where you know, there are so many people that are going to be looking. I do believe, as Rob suggested, with Work One, with the Chamber, with all the Grace College, with all the job fairs. I think Times Union had done one a while, or not Times Union, excuse me, the radio station had done one. At any rate, at some point, there will be, I'm sure, a response locally with job fairs. I don't think we're in any way, shape, or form that's foreign to us. It's certainly something that now will be important. And again, how quickly this recovery occurs is, I suppose you can turn the TV on any night and any weekend and listen to the debates on the economic impact, and I'm not going to try and go there. I mentioned Professor Hicks had talked about a significant downturn in this quarter, and his two options were whether the third and fourth quarter rebound quickly or whether they stay depressed. So everybody's not locking into anything, I think, at this point. So there was a question from Mr. Spalding. Said South Bend is leasing a Motel 6 to reserve for COVID, and the story mentioned the bed space would be available to several counties, including Kosciuszko. What is the chance at this point that could be necessary? Commissioner and I had been approached by a representative from District 2, which is our Department of Homeland Security district. I think there's 6 counties in District 2, and there's money for the district to go to one such facility. My understanding, it was more for homeless. Carrie, do you?
Yeah, that's what I mean, the hotel or the motel, that's how I understood it, that was for homeless if they needed that.
And the idea was those would, what I understood from that is if there were someone with symptoms but not required, continued care, they would be observed in that facility, and then if they required hospitalization, they would be sent back to the hospital. I think in an effort to take some of the pressure off of the hospitals. That's the theory. That's what we were told. I guess, again, in response to, well, I'll let Dr. Remington ask that question if you think that's something that we will utilize.
I think the shelters have felt really vulnerable through this whole thing. And alternative sites for COVID or suspected COVID, sick, but not requiring hospitalization, certainly comes to play if you need it. Whether we will need it in this county or not, I'm feeling less of the weight of that in my mind today than I did 10 days ago. I think one of our local shelters has just done a heroic job in being a champion for his residents there. And I'm not sure where they are with looking at an alternative site, but I know several days ago that was part of their discussion.
One other question from Mr. Spalding, and I think this again goes to you, Dr. Remington. Just an update, and I think you've talked a little bit about this, but an update on a predicted peak for our county.
Hard to say. I said last week, probably within the next 2 weeks, and I think I'll still say that this week.
Okay.
Into early May, though. What is, again, not clear is if we, as representing rural counties not heavily impacted yet, will have an out-of-phase rolling hill compared to the metropolitan areas. Right now, I think we're fairly close to the Indiana aggregate look, and I think we'll see a peak maybe within the next 2 weeks, maybe 3.
All right, and I think that brings us to our most common question to you. If this were a baseball game, what inning this week would you say we are in?
I'll say 4th inning.
Okay, so you've been consistent. That's a good thing. Gentlemen, any further questions? Nick?
You were talking about that economic forecast that Dr. Hicks had. Was that just like a general outlook, or was that incorporating, what local businesses are losing out on right now, or events that the city might be holding, like, the concerts were canceled? First Fridays usually bring in a lot of people from the downtown area. Did that incorporate stuff like that, or you possibly have an outlook on what things like that getting canceled are going to do in the short term or even the long term?
Yeah, this was more empirical. It was really looking at the impact of the unemployment numbers on the income tax, state and local income tax for the communities, and it just used I'm sure broad data to try and come up with that. I don't think there wasn't a deep dive into specific communities, but what it did look at was it basically looked at the revenue from each county, and it didn't even really go into cities. It just looked at the counties, and it extrapolated this data, this formula to each county's current revenue and how their revenue may be impacted in 2021. So that has been released. It's Dr. Michael Hicks at Ball State University, and it's I think it's the title is something about the impact on local income from the COVID. It should be pretty much at the top of his papers. He's done several. And, again, as an economist, I don't think he drills down to those levels at the community. And I'm sure he's painting this picture with a very broad brush. I'm sure it could be a lot worse in some counties and maybe not as bad as others. But this is our first data-driven look at what could potentially we would be facing maybe in our revenue for next year. So, gentlemen, any further comments? All right. Well, thanks to Dr. Remington, Commissioner Groninger, and Rob from the Chamber, Times Union, and WRSW, and AM News Now, and Dan Spalding from Ink Free, who's remotely with us. We appreciate it. Again, we will hold our next press conference a week from today at the same time, 10:30, same format. And again, thank you all for continuing to do what we're asked to do to try and shorten this thing and get us back to somewhat semblance of I won't say normal because I'm not sure what the new normal is going to be, but at least less restrictive than where we're at now. So again, thank you all. Gary, thank you.
Yeah.
Rob, thanks. Appreciate it. Yep.